We begin with the nationwide vaping crisis. New numbers show it's getting worse.
The number of people with severe lung illnesses possibly tied to vaping has gone up in Wisconsin. Now, state health officials say there are 73 confirmed and probable cases, up 4 from just a week ago. Nationwide, that number has climbed to nearly 1,300, with, as we mentioned, 26 deaths.
12 News' Ken Wainscott is live outside Children's Hospital, where the doctors who sounded the alarm are calling on Congress for help. Ken?
Yeah, that team of doctors met with Wisconsin Senator Tammy Baldwin here at Children's Hospital this afternoon to see what more can be done to try to help reduce the growing number of serious illnesses related to vaping. And that meeting occurred right at the very moment that those new government numbers shed a spotlight on the crisis.
1,299 reported cases of lung injuries related to vaping.
Senator Tammy Baldwin had just received the new CDC numbers as she heard firsthand accounts from the Wisconsin doctors on the front lines of the vaping crisis.
I saw her at 1:30. By 2 o'clock, she was in the emergency room, and by 3 o'clock, she was already in the ICU.
Dr. Jennifer Schreiber told the senator about an 18-year-old patient, one of the first in the nation to be identified with the serious lung illness related to vaping. In that patient's case, just in time.
I thanked her for not dying on me that day, and she thanked me for saving her life and getting her to Children's.
Baldwin wants congressional hearings on vaping and has called on the CDC to step up its efforts, but says local government needs to act as well. Is this something that should be addressed at the national level?
We've seen states and localities now go much further than probably could ever be achieved at the federal level.
Baldwin had pointed to cities that have done things like ban all electronic cigarettes and vaping products.
I don't see that happening at the federal level.
The doctors, meanwhile, say the most important legislation would be one that keeps vaping products away from kids.
Increasing the age to the age of 21 where they can legally buy it, I think would be helpful.
But Ken, are the doctors worried that government action won't happen fast enough to address this rapidly growing health crisis?
You know, Patrick, I actually asked the chief medical officer here at Children's about that. He said he would love to see things happen faster, but right now he said what's most important in terms of legislation is to get lawmakers, state and federal, to just understand the facts around this and realize just how serious this crisis is.
Ken Wainscott reporting live outside Children's Hospital.